Biometrics is a concept that was created for overall wellness, men and women's health wellness, but we mostly do men's wellness here. We do it through bioidentical hormones, nutrition, exercise, and overall well-being and balance. So our clinic is geared towards weight loss, optimal health, feeling very well, mentally and physically, to reach your most optimum goal, like I said, through those different modalities. Our main modality is, though, bioidentical hormones, mainly testosterone.
Yeah, it's excellent to see that you do have so many options that to approach the well-being of your clients. There's a gym, there is massage therapy, there is the hormone replacement, there is all kinds of things here that it's a one-stop shop. Mm-hmm. My question to you is, at what age should we start considering an evaluation of hormone replacement? And is there any symptoms we should be watching out for?
That's an excellent question. Some people think, okay, well, if I'm 30 years old, I might be too young, or if I'm 25 years old, or too young. What I tell the general population is, let me know how you feel. If you feel sluggish, run down, got that brain fog, decrease in libido, just overall feel like you're not at your optimal health, we can come and do an evaluation, because not only are we going to do a hormonal evaluation, it may be diabetes, it might be high blood pressure, it might be a thyroid disorder, maybe psychiatric, depression, anxiety. It could be multiple things, kidney issues. So our job is, come on in, let's do our evaluation, come see our amazing nutritionist, get our body mass index testing, get a fitness evaluation from the trainers, and see where you land. If your hormones at the age of 30 are low, then we can do something about it. If your hormones are normal and we find another issue, then we can work with that issue, work with your primary care doctor to, once again, optimize your health, because we are a full-fledged clinic.
Now, this may be a silly question, but I know it's in the back of a lot of guys' mind. What is the difference between this and straight-out steroids?
Well, you have to remember, most people, when they use the term steroids, it is a general term. Testosterone is a steroid, but we use a bioidentical steroid that's naturally in a man's body, and even a woman's too. Obviously at different levels. For men, it's a little bit higher. For women, it's lower, but it's still present. When the general population starts thinking about steroids, they start thinking about anabolic steroids, and those are not good steroids to use. Number one, they come with multiple eye problems, heart issues, clotting issues, vascular issues. You can have your gonads shrink, for example. So those are very short-term gain with long-term side effects. At our clinic here, we use hormones that are going to help the body, enhance the body, that is already in the body.
And at the moment that you decide this is what you're doing, is this a lifetime commitment?
For the most part, yes. I mean, some people will do testosterone for a little while and then maybe stop over maybe a year or two. But overall, what we try to instill in our clients or / patients is a lifetime commitment of nutrition, exercise, overall well-being, reduction of alcohol, no smoking, reduction of stress, and eating well, and just overall being well. So yes, biometrics, the concept, is a lifetime commitment, but the testosterone is only a part of it that you can commit to for the rest of your life, or you can do short-term goals with caveats and with caution.
Is this something that you need your primary care physician to recommend, or can they just walk in?
They can actually walk in, because I myself am a family practice physician, a primary care physician. We will do your assessment. And like I said, if we find anything outside of the parameters of what our clinic is, we'll be happy to contact your primary care physician, or we'll be happy to write a letter or notes describing what we found to speak, so you can speak to your primary care physician. But no, anybody can walk right on in and just get an evaluation.
Now, I've seen some guys that are doing this because they're in their early 30s, mm-hmm. They are athletes, and they don't want to do anabolic, but they feel that this also, they maintain a top edge on things. Is this true? Is this...
Yes, sir. We do have a couple of patients that want to do that, and I strongly will tell them, number one, we're a medical clinic, and we have to follow, the American Academy of Family Physicians. We have to follow health care guidelines, number one and foremost. If I feel that a patient is trying to use this to maybe get an edge, maybe gain more muscle, but they have good testosterone levels, are all healthy, I truly try to discourage them to seek other modalities other than trying to boost a testosterone level that it's already healthy for them naturally.
Right.
So we definitely try to discourage that, because in the long term, that might be unhealthy for a patient as they get older.
What would be the consequences?
Well, number one, at some point, your body's going to stop making its own testosterone, so we have to be on this almost forever. Number two, like I said, with the risk of diabetes, it may happen if we don't use it correctly. Now, remember, bioidentical hormones have a decreased risk of clotting, blood clotting, diabetes, macular degeneration, eye issues, heart issues, and kidney issues. But if we're not careful, those risks can happen. And when you're younger, we want to try to mitigate those risks, because we want the body to naturally make testosterone. We want people to naturally build muscle with good nutrition, hydration, different modalities, so we don't harm the patient.
So what I hear you saying is that as long as you're having a good lifestyle, healthy lifestyle, your testosterone levels should maintain at their peak?
Should maintain, but there are certain things that do occur that drop your testosterone level. Stress, different medical illnesses, alcohol, drugs, especially high stress lifestyles. So it's dependent always on the patient, depending on their life, how much they weigh, if they're obese, if they're thin, if they do drugs. So once again, we try to encompass all the modalities to optimize testosterone levels, not just using testosterone injections itself.
Dr. Muñoz, thank you so much for all this information. Before I let you go, is there anything I'm missing out that I should know?
Yes, Biometrix is a clinic that mainly we do see a lot of men here, but we are starting to see more women in the clinic, because some women are also feeling fatigued, run down, tired due to the stress of life. So we definitely will see women to optimize their health, and we will use different modalities to help men and women achieve their healthcare goals. I want people to understand that Biometrix is a combination not only of a hormone clinic, but a gym, that we actually do a prescription for training, a prescription for working out, a prescription to lose weight. And this is where our nutritionists, everyone comes into play to be basically your team coach to get your optimal health.
Excellent. Thank you so much for the opportunity to be here. I hope you allow us to come back, follow up with whatever new things come out of the clinic, and maybe test out some of your services at some point.
Thank you very much for the opportunity to speak to you and to the public.